So our next speaker is our own Dr. Chou, who is a graduate here from UBC, and we're very glad to have her join us back here at UBC Cardiology Division. And any of you, some of the SCAD enthusiasts here would know she really was instrumental in helping to get the SCAD rehab paper that we have published back a few years ago now, and amongst other projects that we did together in SCAD. So welcome, Annie.
Thank you, Catherine. Thank you everyone for having me. And thank you for spending the Friday of the long weekend here with us today. So you guys have already spent the morning talking about the potential predisposing factors for SCAD, including all the arteriopathies. So right now we're going to expand on that and talk more about the emotional and physical stressors that may necessitate SCAD. These are my disclosures, none of which are relevant to this talk. Now, I know you have already talked about the paper in 1931, the first recorded SCAD case, but of course I prepared my presentation before knowing what other people were going to talk about. So now you understand why I have this picture up here. Fish and chips, fried fish and potatoes. Now you've already heard about this, but the first recorded case of SCAD was in 1931. And I'll highlight this is repetitive, but back in that study, that paper that was written, and I apologize for the blurriness of this image because it was a long time ago in 1931, but the physician that reported this case of SCAD, and a 42-year-old woman, was in the British Medical Journal by Dr. Preddy, and he noted that the patient, soon after partaking of a good meal of fried fish and chipped potatoes, that was a good meal, she then had lots of severe retching and vomiting, and that went on all night until the physician was called about it the next morning. And at that time, he had ruled out anything significant, so he prescribed castor oil and a mixture of bismuth and soda, which we don't normally use anymore, but he prescribed that, and off he went. But unfortunately, 19 hours later, the physician was called again because the patient had unfortunately passed away 19 hours later. And at that time, when he went back to the house, he got a better history from the husband, and the patient did feel better after the physician left, but unfortunately developed chest pain and nausea later on that night. Was quite restless in bed. And she finally got up at 3 o'clock in the morning and said she had to vomit, and when she vomited, she suddenly fell back and passed away in her husband's arms. So this was the first reported case of SCAD. And on the autopsy report, Dr. Preddy saw that the pericardium in the sacroiliac part was full of blood, and that the problem was the right coronary artery, or the RCA of the heart, had dissected, and it had also ruptured. So he presumed it was at that time that she was retching, last time that she was retching, that she had ruptured that artery. And maybe it was the fried fish and chips, but maybe it was the retching movement that caused this. We may never know, but this is what the autopsy showed. And that isn't an unusual presentation of somebody with SCAD, as we now all know. A bit of more of an extreme case, of course, but the usual story is a healthy, young woman, maybe older, maybe postmenopausal, but no apparent cardiac risk factors. I'll present another case. This is 3 weeks after an uncomplicated pregnancy and labor and delivery. This young woman then had sudden, sharp chest pain at rest for no reason, radiated to both arms. And when the pain persisted, she then went to the emergency room. And at that time, her vitals were stable and her physical examination was normal. Now, as with a story like this, the first thing we think about is a heart attack. And sure enough, her troponin, her cardiac enzyme, was elevated, and her ECG, or heart tracing, did show signs that she was having a heart attack. But when she underwent a coronary angiogram, you can see where the arrow is that she had type 2 SCAD. And so that area there where the arrow is, there's narrowing of the blood flow in that artery there. And the diagnosis was spontaneous coronary artery dissection. So she was treated conservatively with medications without a stent, and there'll be talks about this later on about the management of SCAD. And 4 months later, when she had a repeat coronary angiogram, you'll see that artery where the arrow was is nice and opened up again. I don't think I can point to it, but you don't need to see the fried fish again. All right. Now, I won't go into detail because you've already learned all about the pathophysiology and the proposed mechanism of spontaneous coronary dissection, so I'll skip that slide. Now, we actually don't know 100% the etiology of SCAD. We certainly have lots of hypotheses and mechanisms in our heads that we are hoping to prove or to refute. But what they're thinking right now is that there's some sort of predisposing arteriopathy, so some reason why the artery of the heart is weak in some way. And this can be an acquired condition, so it can be from atherosclerosis, or it can be other. It can be an inherited problem, or it can be an acquired problem. And you've already heard about some of the potential precipitating or predisposing factors, including connective tissue disorders, such as Marfan's, systemic inflammatory diseases, such as lupus, fibromuscular dysplasia you've heard about, but certainly hormonal changes and sudden hormonal changes have been implicated as a predisposing factor as well. And pregnancy, which is the time when there are lots of fluctuations in hormones, that has also been thought of as a predisposing factor. Now, you pair that up with a possible stressor as well, a precipitating stressor, and that can be some sort of shear stress on the artery of the heart. Then that can be from intense physical exercise or from intense emotional stress, or some sort of stimulation on the heart from cocaine use or amphetamine use, and that together can result in SCAD. As a few examples that I just made up, we can think about hormonal changes, for example, during pregnancy as the first example. And the thought is that the hormones can potentially change the architecture of the arterial walls of the heart, and then that causes maybe perhaps vulnerability or some weakening of the arteries. And then maybe during labor and delivery, when the patient's pushing, trying to deliver a baby using that straining motion, that then the result could be a tear and SCAD. That can be the potential mechanism for that type of example. Chronic inflammation, which you've heard about already, that can result in neovascularization or new blood vessels being formed. And when that happens, these vessels are smaller, a little bit more friable or less stable, and maybe they're more likely to rupture. And if that is in fact the case, they could potentially have SCAD as well. So just a couple of possible examples of this two-hit process, if you will. Now let's talk about the precipitating factors. There have been numerous case reports out there about potential triggers that have led to SCAD or been the precipitant for SCAD. So coughing is one of them, retching is another, even birth control pills in some case reports, IVF, in vitro fertilization. One case was a patient using beta-HCG, I think, for weight loss. Beta-HCG is a hormone during pregnancy that's quite elevated. So this person was taking that hormone injected into her body, and that also precipitated SCAD. And another example, stimulant use, such as cocaine in this picture, has also precipitated SCAD. Now, if we were to take a bunch of experiences with SCAD and figure out what percentage of people had precipitating factors, and I'll present two single-center studies. One that was done here in Vancouver by Jackie here at Vancouver General Hospital. We have an updated version on this that I will present in just a second, but 168 patients at the time that this was published in 2014, but also another single-center study in Olmsted County in Minnesota of 87 patients. And in the majority of cases, over 55% to 57% of patients actually did recall a precipitating factor. And that's in the blue as opposed to not recalling a precipitating factor in the orange. Of these precipitating factors, about 40.5% were emotional precipitants, emotional stress. About 24.4% were some sort of exercise-related physical stress. And of that, about half were heavy isometric activities. So this is pushing or pulling against resistance. Now the other the other reported precipitating factors included retching, defecating, coughing, and this is what we call the Valsalva maneuver when you're straining against a resistance. And methamphetamine being used was also one of the precipitating factors in this particular case study. Now this is the updated 2016 data from Vancouver General Hospital for the SCAD cohort, now up to 288 patients. And this compared men and women and a few factors that I'll highlight here. So the men that presented with SCAD were much fewer men than women, 25 versus 263. But the men were younger on average, with a mean age of 49 years old versus women with a mean age of 52. But the precipitating factor was mostly isometric exertion for males. Male patients with SCAD, about 44%, whereas with females, it was an emotional stressor, about 55%. So there's a difference between male presentation for SCAD and female presentation for SCAD. Why are these precipitating stressors, what's the mechanism behind these stressors causing SCAD? The thought is that with these exertional activities or emotional stress, there's a lot of release of catecholamines, or stress hormones, and that can lead to shear stress on the coronary arteries of the heart, and that can then cause dissection or rupture of the intima or the vasovasorum, which, as you know, are the arteries within the medium or the muscle part of the coronary arteries. And or, for example, if the heart is going really fast and the contractility of the heart is increased, that can certainly cause an instability, unstable situation, and cause SCAD. The hypothesis, this is the hypothesis, but this has not been tested yet or confirmed yet, but certainly studies are ongoing right now to look into this. Now, I've already said that about 55 to 57% of patients do recall a precipitating factor, but that means about 45% of patients don't. So this is a reminder to us that it is a very complex interplay between the predisposing factors and the possible precipitating factors that accounts for SCAD. So lots of questions to be answered still. So just to summarize, over 50% of SCAD cases do have a precipitating factor, or at least patients can recall a precipitating stressor. The most commonly reported stressors are emotional stress, especially in the female patients with SCAD, or physical stress, especially in male patients with SCAD. And the thought is that these catecholamine surges during times of stress cause shear stress in the presence of an underlying arteriopathy that leads to weakening of the heart vessels, and that then leads to SCAD. And maybe the most important take-home message